Welcome to Cholangio Heroes, a video podcast that is produced by the Cholangiocarcinoma Foundation. I'll be the host today. I'm Jennifer Weaver. I'm the Director of Communications for the Foundation. And joining me today, I'm really excited, is Dr. Shishir. Remind me the last name.
Maithel.
Maithel, thank you. Want to make sure we have that right. Dr. Maithel. He is a very valued member of the Scientific and Medical Advisory Board for the foundation, but I'm going to let him give you a little bit more about his background and what he does and his connection to cholangiocarcinoma.
Okay, hi, welcome everyone. It's great to virtually see everyone. I am a surgical oncologist. I'm at Emory University for the past 12 years. Very interested in cholangiocarcinoma and biliary tract malignancies, and have been just extraordinarily fortunate and blessed to be introduced to this group back in 2015, and basically just fell in love with the group and have been intimately involved with them for the last 7 years. And I will say, learned so much from them and patients, and just going to conferences with patients side by side. It's just been an amazing experience. And also, I think it's been a very beneficial for me, and from an academic standpoint, in terms of being introduced to so many of my colleagues who have similar interests and like-minded people who are thinking about cholangiocarcinoma and really working to forward the field and improve the care and management of patients with cholangiocarcinoma. So it's led to a lot of exciting research and clinical trials and opportunities that we'll talk about a little bit more today as well.
Yeah, just from what you were talking about, you said patients several times. So it seems like you've really got patients' best interest always at the forefront. So yeah, share with me what you've been doing. Share with me what you've been doing as far as putting the patients first.
Yeah, so one kind of theme that I've been personally working on a national level is this concept of really working and collaborating with our medical oncologists side by side, and taking all of the advancements and excitement that's happening in the metastatic space with targeted therapy and personalized therapy, for example, with FGFR2 inhibitors or whatever it may be, all the advancements that are happening in the metastatic space, but really trying to bring those into patients in the locally resectable or the early stage disease. Because what happens so frequently is there's more patients with advanced disease. That's where the trials start running. And then 10 years later, once you see all that data, then people start to extrapolate the new drugs and the new therapies that are happening there to patients with early stage resectable disease. And I don't think that's a good service to our patients who do happen to have resectable disease. So my big focus as a surgeon and a surgical oncologist has really been to collaborate with our medical oncologists. And I have 2 trials going. One that we did where the gemcitabine, cisplatin, nab-paclitaxel regimen, or the GAP regimen, that's being run in the advanced disease space and just completed accrual at SWOG 1815. That trial, we did a neoadjuvant study for patients with resectable but oncologically high-risk intrahepatic cholangiocarcinoma. And it was a feasibility study that we did amongst a couple institutions, showing that we can actually take those advancements and that triplet drug regimen and give them to patients in the preoperative space and then still operate on them. And we're trying to see, what that's going to do. We're taking it to the next level. And the next trial that I'm actually co-running with Dr. Rachna Shroff, one of the very esteemed medical oncologists in this space, is looking to do next generation sequencing in the preoperative space and actually deliver targeted therapy. So we're focusing on FGFR2. So that's one theme that we've been doing, is really focusing on bringing novel therapies in the neoadjuvant space prior to surgical resection, which is not something that usually happens. And then we're trying to do it concurrently, so we don't have to wait those 10 years to really bring the benefits of those drugs to patients who have resectable disease. That's been one line. Another line of thing that we've been doing, and again, all this has been made possible through the Cholangiocarcinoma Foundation, the connections and the networking and the patient advocacy that we get all the input from Melinda and other people. It's just been phenomenal. Another one we've done, which I think a lot of you have heard, is Melinda's talk on the surveys that we've done, looking at patients' attitudes toward treatment, the disease, and travel, and all of that. So that was an amazing experience, which we did together with PanCan, actually, and sharing cholangiocarcinoma and pancreas cancer patients. But another thing we did a in collaboration with Citizen, we did surveys for patients, and we're trying to really look into patient-reported outcomes and look at the quality of life that patients experience when they're diagnosed with these diseases, the treatments they go through, the financial toxicity that they bear in order to receive these treatments and go on clinical trials and receive personalized therapy. So we've actually done a couple of studies with my fellow Dr. Kielsen in collaboration with the CCF and with Citizen and Invitae, looking at that. And that's been presented at ASCO, at SSO, and we're actually in this. We just actually submitted the manuscript this morning to one of
Oh,
the
that's exciting.
yeah, to one of the journals this morning, looking at the patients aspect. I think too often physicians will focus on the disease and the treatment and the response and the radiologic imaging, and I think infrequently do you really focus on the patient experience and what does it mean to them and the balance of quality of life with quantity of life. And I think all of that really needs to stay at the forefront. So that's been another line of investigation we've been doing through Cholangiocarcinoma Foundation, is because we have access to the patients, and that's what's been amazing, is access to the patients all across the country and world for that matter. And then the other thing we're doing really is, in order, kind of in line with that, is to try to kind of structure the data of all patients being treated for cholangiocarcinoma and trying to create a prospective cholangiocarcinoma database or a registry that will be ongoing and kind of will be just an incredible wealth of information that we can look at and study to really learn more about the things that we're doing and the current things we're doing, but more importantly, to set up a foundation to do more trials and really further disease and improve the care of patients with cholangiocarcinoma. So that is being done in collaboration, again, with my group here with Dr. Kielsen, but also the Cholangiocarcinoma Foundation and now Citizen/Invitae, where we are basically asking patients to sign up for that registry. All of the data then will be kept and accrued through Invitae and will be updated every 4 to 6 months. So it'll be a living, breathing database that will continue to collect patients being treated for biliary tract cancers across the country. I think that'll be just a wealth of information for people to look and study, and then ultimately a platform for us to do clinical trials in the space using that, which will be so much easier and much more efficient way of doing clinical trials.
Yeah, I'm really impressed with the trajectory of your research, because it's at an accelerated pace, and that's kind of unprecedented. So the way that you're thinking about bringing these things together on behalf of the patient is pretty amazing. Actually, I wish the whole medical field would tackle things as aggressively as you are on behalf of patients. So first, I want to say thank you, and then I want to kind of backtrack a little bit, because we may have an audience that doesn't understand what cholangiocarcinoma is, let alone a patient registry and clinical trials. Can you kind of go back to the basics? If you were talking to somebody who'd never even heard of cholangiocarcinoma, could you explain that?
Yeah. I mean, so cholangiocarcinoma is basically a blanket term for cancer of the cells that line the biliary tract. And the biliary tract is basically in the liver. You have bile ducts that come together outside the liver, and then they go through a tube and drain into the intestine. And you can have cancers of the biliary tract inside the liver or outside the liver. And outside the liver, they can be kind of where the two ducts are joining from the right and left side, or kind of at the most distal aspect. So those are kind of the three spots where we look at cholangiocarcinoma. We call them intrahepatic, hilar, and distal. And so it's a rare disease, but it is a disease that's difficult to treat and difficult to diagnose sometimes. And also the fact is that of patients with biliary tract cancers, only probably about a third or 40% of them ever actually are amenable to surgery because they're presented at later stages. So there's a lot of research going on in terms of how do we earlier diagnose them, but how do we treat them better? We're understanding the genetics better of these cancers. And so by putting a database together, what will happen? Because it's a rare cancer, we're trying to take advantage of this community that the Cholangiocarcinoma Foundation has just beautifully organized. It's not only a U.S. community, it's an international community. So we're trying to take advantage of that community that the CCF has really gotten incredible support from in order to create this database of patients, because at every one institution, we're only going to see a few of them because it's such a rare cancer. And even at the quote unquote big centers like ourselves or any of the high volume centers, still the numbers are not like you see with breast cancer or lung cancer or things like that. Those are much more common. So by doing this kind of national database, that any patient who has it, if we can get patients to sign up for the registry through Citizen/Invitae, then basically all of your medical records will be centralized into one spot. And that's the key. And so we will have patients from all over the country. All of their medical data will be centralizing into one spot. And then also, as you get further care, every 6 months, we're going to update your data and see where you are, what treatments you got, what the scans look like. And so it'll be an amazing resource for really understanding how patients are doing, how patients react to the treatments we do, how our treatments are working. And then also, Cholangiocarcinoma Foundation is tag teaming on that. To the patients who sign up, they will also be doing patient-reported outcome data, understanding the quality of life as well. So Citizen and Invitae will be kind of basically getting us the quantitative data in terms of what drugs you got, what the tumor's doing, how things are working. And then CCF will be administering surveys to those same patients who signed up to see, okay, how does it feel? What's the financial toxicity that you're having? What is it to your personal life? What is it to your social life? What is it to your mental being? All of those. And so putting those together will be an unprecedented resource
Right.
rich wealth of information that we'll be able to use and get better.
Right. And I think that one thing that we would really want people to know is that the personal information, I mean, this is somebody's health and medical history, that this database actually protects it. It's secure, it's private, so it's not being shared. And I think in this time and age, people are a little bit hesitant because they are fearful that their information is going to be sold or used in some way. Can you explain how it is protected, or how the process is, so that when researchers have access, they don't see the person's address, they don't see even the person's name? Can you explain that a little
No,
bit?
that's a great point. So all of the data is what we call de-identified. So obviously, when you sign up, Citizen will have to know who you are and will have to know where you've been treated. And so they'll know, but all your information will go into a protected database. But your name and any identifiers that would basically track that data back to you as a person will be eliminated from that. So it'll be like an ID number: 1, 2, 3, 4, 5, 6, and so we'll. But of course, Citizen will know ID number 1 corresponds to patient X and ID number 2 corresponds to patient Y, so that they can update the data. But in terms of physicians or any researchers utilizing the data, they'll never know who anyone is. It's all basically just data tracked to a patient, an anonymous patient. So it's extraordinarily
Yeah.
safe.
Oh, that's just really, really good to know. Before we end this wonderful interview, I want to keep you talking to you, but
Yeah.
there's something also that you've been working on, and I think it's a project where um, there's iPad minis involved, but I'm not exactly sure if you can
Yeah.
dive into it. But can you share that with me a little
So
bit?
the,
'Cause
the
I'd like
iPad,
to know more.
yeah, no, the iPad portion of my research really is to optimize the registration of patients for the database. So right now, if a patient were to go to the clinic and let's say see me in the clinic, and I introduce the concept of Cholangiocarcinoma Foundation and the Citizen and Invitae and the database that we're doing, it's a very quick sign up for patients. You just have to go on a website and literally click a couple buttons and sign up. And so the point of the iPads to introduce them to the clinics is that so then it'll facilitate patients signing up for this process real time in the clinic, as opposed to them going home and having to get on their computer and log on, and will eliminate all those extra steps for patients and really try to make it easy for them once they're there with the physician in front of them explaining everything. We can hopefully just get on the iPad real quick and do it. And I think by doing that, we'll be able to increase and optimize the number of patients that sign up for this, so that we can really optimize the strength of this database and we can all get better. And ultimately, the goal of all of these things, whether it's the trials we're doing for neoadjuvant or preoperative trials,
Mhm.
whether it's the patient-reported outcomes and seeing how patients respond and how the therapies we give really affect them and their life and their quality of life and their mental state, and or whether we're asking them to sign up so we can use their data. All of them, really, the goal is to make the care better for patients and to try to beat the disease. But you have to remember, I'm a very, very big believer in this. You never want the treatment. I've learned this in my fellowship, but you never want the treatment to be worse than the disease itself. So I think that really emphasizes the importance on patient-reported outcomes and quality of life, because you could keep throwing drug after drug after drug, but if you're killing the patient with a drug and their quality of life is horrible, then you have to really ask the patient, is this what you want? And so all of my kind of thematic things I do are ultimately, and everything we do is geared toward the patient, really, to help things get better.
Well, not only do you involve the patients, but you empower them so that they also have the decision-making power of their life. And
Absolutely.
so I just commend you. Like I said, you're such a valuable member to the foundation, and we're so grateful to you. So if there's anybody out there listening to this podcast and you want to support this effort with iPad minis or help with grant funding or anything, please contact the Cholangiocarcinoma Foundation. You can find us at cholangiocarcinoma.org. To make it simpler, you can actually also find us at curecc.org, because obviously that's the ultimate goal. We want to cure cholangiocarcinoma. So thank you again, and all our listeners and our watchers, because we're also on Spotify, so you can listen to this, or you can not only find us on Frontliners TV, you can find us on other stations as well. I'm really excited to announce that you'll be able to also find us on Hero Go. So we've got some other opportunities, and we hope that you'll find us there. So thank you again, Shishir. I'm just so grateful for you. And everybody, we have another episode next week, so join us then. Take care until then.
I just want to end with saying thank
Oh,
you
sure.
as well to all of you and what the Cholangiocarcinoma Foundation does, and really thank you to the patients, because the patients really, you're the ones who give us the strength and the motivation to keep doing this. And I have the utmost admiration for what patients go through. And it's very easy for physicians to say, take this, take this, take this, but every day in clinic and every day when I round on my patients in the hospital, I'm just completely blown away with the strength and the fortitude that patients demonstrate on a daily basis having to go through that. So thank you for sharing that strength with us and helping us to get better. Appreciate it.
And that is the best way to end it. Patients first and always.
Yeah.
Thank you for joining us next week. Take care, everyone.
Bye.